it was perfectly logical for the CDC to say, wait a minute, we were planning on ending this mandate on a certain date. Let's wait a period of time until May 3rd. So for a court to come in and interfere in that is really unfortunate.
Dr. Anthony Fauci criticizing the ruling from a federal judge in Florida that struck down the CDC's travel mask mandate. The Biden administration is now appealing the decision. Let's discuss with Dr. Michael Osterholm, director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Good morning, doctor. Let's go straight to that issue. If that is not overturned, what does that do to the CDC's authority going forward in any other health crisis?
Well, I think it is a real challenge because this is not going to be the last of the need for public health measures to be taken for any crisis. I mean, what could be the next crisis of tomorrow? So on precedents, this case is very, very important. I think the confusion around the mask mandate itself and how effective it is a secondary issue, but one that is still important too.
And let's go to that. The overall mask mandate is totally confusing, especially this week. Mandates lifted, mandates returned, reinstated, lifted again. You told the New York Times this week public health advice has been way off the mark all along about mask protection. So what do you see as the best guidance?
Well, it is off. First of all, let me be really clear. I am very, very strongly supportive of respiratory protection. Someone can do a great deal to protect themselves and protect others if they're using an N95 respirator. But this virus is transmitted by what we call aerosols, these very fine particles that float into the air. It's like smoke. It's like perfume. And you have to have a high-quality respiratory protection device to protect yourself. What happens on airplanes today is really more just check a box. It is not effective. Why? Because, first of all, you have most people not wearing an N95. They're wearing a face cloth covering or even a surgical mask, which is not effective in reducing transmission. Then when you get on board, if you're eating or drinking, you don't have to have something on your face. And then finally, about a quarter of all people wear it underneath their nose, which is like closing only 3 of the 5 screen doors on your submarine. And so that from that perspective, it really isn't all that effective. And so I think that what we want to do is stop talking about masking and talking about effective respiratory protection.
And how do you do that? You talk about flying. I flew across the country this week. About a fifth of the people maybe had a mask on. The others seemed jubilant that they didn't have to wear a mask. So how do you really return to that or advise people whether they seem done with it?
Well, first of all, the U.S. public is done with the pandemic, even though the virus is not done with us. And we have to recognize that in public health. You know, you can't swim against a tide of this magnitude. So what is it that we can do? Well, we have to have credibility. And again, what has happened is this has become really a philosophical and political issue, not a science issue. So and the media at the very outset is one of the problems. They keep talking about masks. That's like talking about the difference between a condom that's intact and a condom that has 100 holes in it, but it's a condom. No. There's very different effectivenesses using these different approaches. And so from my perspective, I would say, particularly if you're an immune-compromised individual, someone who is at serious risk of illness and serious illness, you need to wear that N95 respirator. If everybody could do that, they would keep it on through the duration of the flight, not wear it underneath their nose, then that would be a very effective way to have a mandate. But what we're doing now is we are literally just basically addressing a political issue, not a science issue.
And let's talk about the big picture, about the state of the pandemic right now. Here's what health experts wrote in the Washington Post this week. The United States has experienced a concerning rise in cases in recent weeks because of the spread of new Omicron subvariants. Failing to take this seriously could put vulnerable Americans at risk. We fear that Americans don't have a good sense of the true state of the pandemic. So what is the true state of the pandemic right now? I know people who are vaccinated, boosted, who got seriously ill, but are most people who get this just common cold symptoms?
Well, you know, Martha, every day is a brand new day with this pandemic relative to the variants. You know, 3 weeks ago, we would not be talking about the variants we're now talking about. And any one of them has the ability to evade immune protection, meaning the previous vaccine protection or previous protection you got from having had COVID, may be in jeopardy. We know that we have strains that are much more infectious, so that you can't come up with an answer today to say this is where we're at, because tomorrow it could change. Having said that, we are in a very difficult place in terms of interpreting for the public the fact that we're at all-time lows for hospitalizations in this country. We're at all-time lows for a number of people in ICU beds. That's all good news. But yes, the case numbers are increasing. But they're increasing also at levels of, basically doubling 10 to 20 is very different than doubling 20,000 to 40,000. And so the numbers are still relatively low. But I want to emphasize that could all change tomorrow, and that's what the public is not willing to hear. They want this to be over. And we have to just say with humility and honesty, I don't know what this next 210-mile-an-hour curveball is going to be thrown at us by these variants.
Thank you for explaining that so carefully and efficiently. Thanks for joining us this morning.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.